Hi there, Dr. Zac Watkins here, functional medicine practitioner, clinical nutritionist, and where I hope to help people in their quest for health, especially regarding their female hormone imbalances, GI troubles and problems, fertility and fatigue, which we all have, especially me after a long day. So, a quick question for you is, did you get your protein today? Yes, that is me. That's my quick attempt at drawing. So I bring this up because after a long day of viewing individuals' lab work and hearing their troubles and where they've been and trying to get answers, not only medically but nutritionally, answers to their problems that they're faced with, one of the things that I see commonly that is missed medically, not deliberately or anything, is seeing that people are just not sufficient in their protein intake. And that's troubling because we live in an abundant society with tremendous amounts of access to food, and just we should not have any issues. Or if you've probably heard of malnutrition, we think of third world countries with no access to certain foods. I personally have been to Africa and have witnessed malnutrition firsthand, but here we should not be faced with that. So I would go as far to say that a lot of the patients I see, and even just people I see on the street, are malnourished. And they're eating a lot, but they're not nourished. There's a big difference. And I think being in America or being in society, we've been more forced down the road of eating more simple carbohydrates and even decreased fat foods. I am a fan of good fats. So we're getting away from maybe more protein intake and eating things that we love, like the comfort foods, the macaroni and cheese and the sugar, the sodas and things like that. Over time, it does lead to a protein insufficiency that I commonly see in labs. So what I wanted to say is, I guess, how do I know that? One question, if you have some labs sitting around, pull them out. One of the things I see with people on their labs, I call, it's just called total protein. And when I see levels of total protein on their lab start to drop quite a bit, that can mean some severe things, but from my perspective, it possibly means that they're not absorbing adequately, or they may not have enough stomach acid, or they may not be eating enough. I mean, there's a lot of scenarios that need to be investigated. And in my office, we're not looking at, per se, severe protein deficiency where medically it'd stand out pretty severely, or if we had major liver disease, but optimally we see some change just subtle enough that gives me clues into why we're having the symptoms or the conditions that we're faced with. The other thing that I tend to look at is called blood urea nitrogen, or BUN. It's basically the breakdown of urea and protein in the body, and we need to excrete that, which is a good thing. But watching that, it's usually a kidney marker, but seeing it on the labs can tell me more about, again, is there enough turnover, is there enough production, breakdown of protein in the body. And I like to see the BUN levels, not to bore you with numbers, but 15, 18, higher levels, and instead I'm seeing some, even women, with levels around 6. And I bring this up sometimes in their consults. I say, did your provider talk to you about this? They said, no, it was just a normal thing, or come back and we'll check it later. To me, this is someone who is severely protein deficient, severely not maybe absorbing, may not be eating enough. There's a lot of factors, but that's why we investigate further. So why that relates to, obviously, GI problems, you would understand that. If we can't absorb well or digest well, we're not going to get the protein we need. We're not going to get the amino acids we need. And that's a problem. Well, why it's a problem, I guess I should say, is that we make all of our hormones from protein, our sex hormones, thyroid. Anybody with thyroid troubles? Do we have any protein deficiency problems? That's a big one. Fatigue. We're just not going to get the energy we need to produce these energy pathways or promote these energy pathways. A muscle. Maybe you're an athlete or working out. Or even if you're sedentary. We don't obviously promote that, but you got to have protein to sustain bodily functions. So huge problem. So it sounds very simple, but ironically or oddly enough in our office, it's common. Fertility is it's common to see women with low protein levels, and we're not going to make the hormones we need. We're not going to make the energy we need to support cortisol, which is the energy hormone that supports healthy energy production and immune system and hormone production, progesterone and things like that. I mentioned the immune system. You've heard of probably immunoglobulins. That's the soldiers of our immune system. They're the ones that put on the helmets and grab the weapons and go out and fight for us, which is good. They're all made of protein. People with protein deficiency problems, they're more susceptible to infections, they're more susceptible to illness. We gotta have protein. On a side note, talking about illness, one of the most important things I talk about in my office, and you may have heard of this, is an amino acid called L-glutamine. Glutamine is just an amino acid that you can find most places. L-glutamine. Now, the way I describe that is it's basically an amino acid that your body can take and make other stuff with it. And so it's very abundant. And so, for instance, if you're an athlete or a bodybuilder, mainly athletes, they're going to take glutamine because when they're working out and breaking down muscle, we got to replenish that. And obviously they're eating more meats and stuff like that, but glutamine is very helpful to get that in you. The reason I brought it up for malnourished conditions and chronic disease, like let's say cancer, there's a lot of good research that says these cancer patients, when they get chemo, their gut is stripped of healthy cells. That's why it's common to see individuals going through chemo to develop irritable bowel problems and horrible digestive problems. Sometimes they need to be fed intravenously or through an NG tube. So I think a lot of it is just because it just tears down the intestinal tract, and they can't absorb nutrients to get healthier, to fight back, to make the immune system. There's other factors at play, I know, but the research did show that these people need almost 30 grams or more of glutamine per day. Whereas, like for instance myself, glutamine, if I'm going to take that for me, for my exercise routine and things like that, I'll typically get 6 grams to 10 grams a day. I'll put it in a protein shake or something like that to sustain my muscles, sustain my growth, and to sustain health. And so the reason I asked, did you get your protein today, because I fell victim to this. So to be honest with you, when going through, as we're working through practice and going through years of school, not sleeping, not eating well, and even to this day it's a challenge to keep up with a busy schedule. When I started to investigate my lifestyle daily about how I wanted to be better in all areas of my life, I found out that my protein intake was probably close to maybe 50 grams a day, 75 grams a day. And through a lot of, this is a different discussion, but I think the big consensus is people are needing to get, especially if you're more active, about 1 gram to 2 grams per pound of body weight. So for me, that's, I need to be getting like anywhere between 160 to 170 grams a day, and I was getting 50. If I'm even just trying to get on the low side. So I fall victim to not getting enough protein in my diet. When I don't do that, like I said, if I get 50 grams of protein a day and I'm supposed to be getting more like 150 to 170 grams of protein a day, my blood sugar tends to go high and low and high and low. It rides that roller coaster, which, if you've heard me say before, is a major stress on your stress hormone cortisol. And this is why I am more at risk for insulin resistance, cardiovascular disease, fatigue, and those kind of things, because not that I eat poorly, it's just when I do eat well, I don't eat well enough. If I'm getting 2 meals a day, that's not going to sustain me and my blood sugar, and therefore it's going to make me more fatigued and irritable and crabby, and store weight where I don't want it, and lose muscle, and not feel vibrant. So one of the ways I combat this, and I wanted to recommend to you, is what I do is I really look for getting added protein throughout the day, and one of the easiest ways is through whey protein. Now I wouldn't do any old whey protein. Cheaper is not always best. It's like wine. Cheap is not always best, even though there is some good cheap wine. I look for grass-fed whey protein. Now, if you're going for a regular whey protein, that comes from cattle that have more an inflammatory-based diet, grains and things that are very harmful to our health. It's cheap to buy, but it's not going to be helpful. What's the trade-off here? So I always promote and recommend grass-fed whey protein, and there's some good sources out there. I also use one that has not been heated, and it's not heated, which means it keeps the immune properties alive and vibrant in the powder, so that way it's very healthy for my gut and the immune system. If you get ones that are normally heated, it's going to be less expensive, but you lose that component of it. You still get the protein aspect of it, but I always like the best of things I'm doing, so I get the one that has not been heated. So what I do to make it easy, like at night or in the morning, I pack a blender bottle with a scoop of protein. I may do some cinnamon. I may do a dash of vanilla. I'll put in, if I really want some more slow-release carbs, I'll add some gluten-free oats, like a third cup or half cup in there. And then I'll get these little lunchbox coconut or almond milks that you can buy in packs. And they're nice because they don't have to be refrigerated, and they keep in your blender bottle. I just throw it in, and wherever I'm out and about, either at the gym or at the office, or if I forget it's in my car, I just take the milk, add it to everything, shake it up, and drink, and we're good to go. And the oats are nice because I chew it, so it's like a little snack. So that's been tremendous help for me to get more protein. Sometimes I'll swing by like Whole Foods and grab a bag of beef jerky and eat the whole thing, or get some deviled eggs. So I'm always trying to get some source of protein because I tend to fall and get really fatigued in the afternoon, and that's one way that I can stop that, and that's one way I think you should too, is think about during your busy schedule. Don't just get up and live your busy life and then think. You need to think and plan ahead and say, okay, during my time tomorrow, I got to get my protein at this time and at this time, and pre-make these meals. And I think that's going to be so helpful for you. So get your protein, get it often. Again, shoot for about 1 gram per body weight. That's very healthy for you, and we don't want you to be malnourished, and we want you to actually live well and live vibrantly and prevent some of these chronic diseases that we see. So thank you for your time. Post any comments you may have, or email the office at office@drzacwatkins.com. I try to answer as much as I can. I get kind of busy, so if I'm slow, forgive me. I'm trying, but I love trying to connect with people as much as I can, and hopefully that serves you. So thanks for your time, and please have a good day.